So today I want to talk to you a little bit more in depth about the sorts of things to consider when you have that SI joint pain. So yesterday's reel mentioned your glute max, which is the muscle that creates the shape of your bum. It talked about glute medius, which is on the outside of your hip that helps you with your side-to-side control. And I have lots of other posts on this, and I will go into both of these in more detail to come too. But today I want to specifically talk about your pelvic floor, because most of the time when we talk about the pelvic floor, we talk about either its ability to lengthen or lift, or its ability to squeeze or relax. But you also have a front of your pelvic floor and a back of your pelvic floor. And sometimes we might need more function from one or more function from the other, or vice versa, okay? And you also have a left side of your pelvic floor and a right side of your pelvic floor. And this is where it relates. This is where it relates to your SI joint, because remember, we were talking about yesterday that even though this looks like one entity, it functions more like a left side and a right side. And so we need a left-sided pelvic floor function and a right-sided pelvic floor function. And if you are someone who is experiencing one-sided pain, like SI joint pain, there is a degree of asymmetry in your body that you are having trouble compensating for. Some asymmetry is normal until you can no longer compensate. And if you have one-sided pain, that is the sign that you are not compensating for this asymmetry well. And it is usually, often, I should say, an indication that there is a difference in your pelvic floor function on one side versus the other. And so this is what I was trying to show you in yesterday's reel. When you lie on one side and consider your pelvic floor function, you want to know if it feels the same. Keep getting cut off at the most important part. So you want to lie on your side and consider what your pelvic floor function feels like when you're lying on that side. And then you want to lie on the other side and consider what your pelvic floor function feels like when you're lying on that side. Because with something like one-sided pain, but also with things like diastasis recti, with leaking, with prolapse, with a lot of the other issues that women experience with their pelvic floor or related to their pelvic floor function, there is an asymmetry in the way that the pelvic floor itself works. And when you feel like you just can't solve your problems, it's probably because your answers aren't specific enough to your body. And that's what I teach in my online program, is how to understand what specifically is happening for you and how to create the change that you need in your body. So don't miss my sale. It runs through this coming Sunday.